Holmes, case number 12CR 1522. The records reflect that Mr. Holmes is present with his attorneys and the prosecutors are present as well. We are outside the presence of the jury. Are you ready for the jury, Mr. Brockler?
Yes, Your Honor.
Mr. King? All right, let's bring the jury in, please.
Should I have Dr. Feinstein make the stand?
Sure. And for the record, I'm still reading the Microsoft documents. I haven't finished that. You folks give me something to review at every break, and I'm doing the best I can and get back here in time, but it takes some time, so I'm not there yet. Good afternoon, Doctor. Well, let's wait till the jury comes in. Please be seated, everyone. The records reflect that the jury's back in the courtroom. Good afternoon, members of the jury. Welcome back. I hope you had a good lunch. Good. Dr. Feinstein is back on the witness stand. Doctor, I remind you that you're still under oath. And before we proceed, I want to remind you, members of the jury, that the court has admitted the testimony of Dr. Feinstein only for a limited purpose. You may consider this testimony only as to the issues raised by the defendant's plea of not guilty by reason of insanity. You shall not consider this evidence for any other purpose. And I've explained to you multiple times before what I mean when I say only as to the issues raised by the defendant's plea of not guilty by reason of insanity, and you all understand that. And everyone's nodding their head and saying yes, nodding their head yes and saying yes. Thank you. All right, Mr. Brockler, you may resume your direct examination of Dr. Feinstein.
Thank you, Your Honor. Doctor, I want to start with the June 11th appointment, which is where I think we left off. And forgive me if a couple of these introductory questions were ones that you answered yesterday. But did he show up on time for the June 11th appointment?
Yes.
And dressed in an appearance and presentation the same way he had back on May the 31st?
Yes.
Talk to us about what your goals were for that session and what happened.
Our goals were similar goals to the last session, which included still trying to clarify the diagnosis, trying to assess whether he was suicidal or homicidal, especially his ideation, to examine the working alliance to see where that was and to see if we could engage him in ongoing care and potential treatment change from Dr. Fenton perhaps to me, to clarify as best we could the medications that he was on, whether there should be any changes, any additions, to evaluate whether or not he needed to be on a 72-hour hold and admitted to a psychiatric hospital, and to see if we could engage him in ongoing care and treatment as an outpatient if possible.
Let's talk about the medications first. Did he describe to you any changes from the last time you had seen him on May 31st regarding how he was feeling on the medications that he'd been prescribed?
He didn't describe anything different.
Did he display to you any signs of being manic or any sort of mania?
No.
Did he express to you feelings of depression, or did he appear depressed?
No.
Did he tell you that he was feeling suicidal?
No.
And did he appear at all like he was suicidal?
No.
Now, you said you explored with him some more about the homicidal ideation. How did you do that?
Again, asked him questions that were very typical of the VASA kinds of questions that I asked in the first session. The nature of his homicidal ideation, making sure that he had no specific target, no specific plan, no specific time frame, and that there was nothing that we didn't know about that might be going on with him. Assess the frequency of his ideation to see if there was any change, and it was about at the same frequency. The homicidal thoughts were the same, and they were still occurring in general terms, things like hating humanity. They were in very general, almost philosophical terms.
Did he provide you with any extra information in terms of details related to planning or a target or a time frame, anything like that?
No.
Now, when you have described that the defendant sometimes doesn't provide answers to questions, isn't there some way that you have to force him to tell you what's going on?
No, especially because the main goal there is to engage him in treatment and to develop an alliance. Might ask a question several different ways to try to get him to tell us what's going on. And I tried a couple of different ways to get, we were aware he wasn't telling us things, but we had no idea what he was not telling us. We were aware he was withholding information.
What's the concern if you continue to get more aggressive and direct with him in trying to get information?
The concern is that he'll drop out of care altogether, and that was something we really did not want to happen.
So throughout this June 11th meeting, and I can't remember if you told us yesterday or not, forgive me, how long was the session supposed to be?
The June 11th meeting was supposed to be 45, 50 minutes.
And it didn't last that long?
Lasted about 20 minutes.
What other things took place in terms of your exchange with the defendant before that session ended at about the 20-minute mark?
We learned at the beginning of that session through questions that Dr. Fenton asked, and we were both interviewing sort of simultaneously, that he had failed his examination and that he was planning on dropping out of school. And
Stop, forgive me. How did he seem to you about that when he was sharing that with you?
Our initial reaction was we were surprised. He seemed calm, together, in fact relieved when he told us that he was dropping out of school.
Not angry, not worked up, nothing like that?
Not angry, not worked up, no.
Okay, and you were about to tell us then, in addition to that talk about failing, what else did he say?
So I remember that I asked him about why would he want to drop out of school. He had been working his whole life to become a neuroscientist, that I understood that he failed an exam, but that it was very common for students to retake an exam, and graduate schools would like students to stay in because they've invested time and energy, and why was it that he was wanting to drop out? And he responded that it wasn't a good, he didn't think the school was a good fit for him, and that maybe this wasn't what he wanted to do or needed to do.
Did he seem to suggest that this was okay?
Yeah, that was a little surprising to us that it seemed okay to him, that he seemed relieved. I think we were more surprised than he was uncomfortable.
Now, you had talked yesterday in some detail about sort of the areas that you explore with someone when you're assessing them for suicidality or violence. Did you then ask a series of questions to him that were targeted towards getting information about that?
Very similar questions as we did the last time.
Tell us what you asked him why that is important, and what his answers were.
So we did a similar kind of assessment for the level of his ideation. Did he have a specific thought towards a specific person at a specific time? And the answers that came back were answers around him not liking humanity, wanting to be away from people, that people were disturbing to him. We cued in on a past history of violence and didn't find anything. Substance abuse, no substance abuse actively, occasional drink. We asked very specifically, since he was dropping out of school, about what he would do, how he would spend his time, and he told us that he was going to stay in Colorado, that he had a lease that expired in November, that he'd probably stay around. We asked him how he would spend his time. He said that he would probably get a job.
And I'm sorry to interrupt, but can I ask, why are those things significant to you as you assess him? That he's looking down the road with the lease, following the lease, getting a job, staying in town. Why do those things matter to you?
It suggests he's future-oriented, that he's planning on being around, and that he's logical and has a reasonable plan considering what happens after you drop out of school.
Did you ask him other questions related to how he'd get by until he got a job? Resources, other things, support system?
Sure. We asked about whether he had financial support. He said he had $10,000 in the bank. We asked him if he would continue in therapy with us, and he said that he wouldn't need to because he was ending in graduate school and that his insurance would run out. And we offered him a scholarship program that we have at the university where patients can get care for free to remove that objection to his not coming back. We really wanted him to come back.
How did he respond to that?
He said he didn't need to. If he wasn't in school, he didn't need to come back.
Now, up until that time, when he's signaling to you he doesn't want any more treatment, I mean, are you still hopeful that you're going to keep this guy on board and be able to treat him?
I'm starting to be concerned that he's going to drop out of treatment.
And so what takes place then as you get to this discussion of, hey, we'll treat you for free, not interested?
He looks at his watch and says that he has an appointment scheduled at the graduate school to disenroll at the graduate school, and that he's going to be late for that appointment, at which point he gets up and walks out of the office.
And does his departure, was it kind of like his departure other than timing from the May 31st meeting?
His manner, his behavior was the same. It was abrupt. He got up out of the chair and he left quickly, so there wasn't time for any kind of discussion.
Was there any change in his, I guess, his speech, his tone, his delivery, any of that in the words that he spoke to you on the 11th versus the 31st?
No change. He seemed less anxious and more relieved to us.
At that time, did you believe that you had sufficient grounds legally to have forcibly taken him off the street and lock him up for 72 hours?
Absolutely not.
Is that a cure-all, by the way, to do that?
He didn't meet any of the criterion for an involuntary commitment. He had no target. He had no specific person. He didn't specify a place. He never told us about any weapons. So we felt that he didn't meet any of the criterion for an involuntary hospitalization.
Now, I'd asked you about a series of things if he'd talked to you about them at the May 31st session. I want to ask you about stuff leading up to June 11th here. Did he tell you that he had purchased an AR-15 type assault rifle?
No.
That he had purchased a 12-gauge Remington shotgun?
No.
A handgun?
No.
2 sets of handcuffs?
No.
Road stars or spikes that can be used to deflate tires?
No.
First aid kit?
No.
Did he tell you that he had resolved that he would commit a crime at a movie theater near his home?
No.
That he had started to scout out those movie theaters?
No.
Look, doctor, had he told you those things, had he made you aware of those facts, would you have reacted differently at the end of this session?
Absolutely. We would have moved quickly to try to certify him for a 72-hour involuntary and would have called the police.
Did he tell you anything about hallucinations, seeing things?
No.
Flickerings, flashes?
No.
Did he tell you about hearing voices?
No.
Did he tell you about feeling like he was under the control of a master power, or words to that effect?
No.
Did he talk to you about concerns with other aspects of his body, specifically his nose,
No.
his eyes?
No.
Did you ever see him pulling his hair in the trichotillomania that had been reported?
No.
Did he talk to you with concerns that he had odd perceptions of himself?
No.
In your conversations with him, did he ever display to you what you would consider to be disjointed sentences such that you thought he had a thought disorder?
No. His thoughts were logical, coherent, goal-directed.
Any evidence of disorganized thinking at all?
No.
And then did you and Dr. Fenton speak afterwards about steps that Dr. Fenton would take to continue to pursue additional information?
Yes.
Now, and I take it you weren't the one that called Mom or called anyone from the campus or his professors or anything like that?
That's correct.
Did Dr. Fenton report all that stuff back to you?
She did.
May I have a moment, Your Honor?
You may.
I have nothing further, Your Honor. Thank you.
All right, Ms. Hicks, do you have cross-examination?
Yes, Your Honor, I do. Thank you. Doctor, working at the graduate school, isn't it fair to say that a lot of students in, especially in graduate school, or perhaps even undergraduate, are sort of in the typical age for the manifestation of illnesses such as schizophrenia?
Yes.
I'm going to go kind of start in chronological order. I apologize if I jump around. I want to start with your first meeting with Dr. Fenton, okay? You're nodding your head. I'm assuming that's a yes.
Yes.
Okay. You meet with her monthly, is that right?
Yes.
Just to kind of help mentor her on a lot of her cases?
On that and her academic career, publishing, teaching.
So you talk about a variety of those things in those meetings?
Oh, yes.
And the meeting where you met with her on April 23rd of 2012, that was when you had a conversation with her about Mr. Holmes, is that right?
Yes.
Okay. Did you talk about other things in that meeting, or was it solely about Mr. Holmes?
Oh, many other things.
Okay. And those meetings are, what, about an hour long, or?
An hour long, often over lunch.
Okay. So you spent some time within an hour talking about Mr. Holmes with Dr. Fenton.
Yes.
Now, yesterday you said that Dr. Fenton wanted to bring you in to consult with her, and we'll get into the reasons why. But when you talked to her on the 23rd, did you review her notes of her appointments that she had had with Mr. Holmes?
No.
Okay. You said yesterday that you, after that, though, did go and talk with Margaret Roth?
Yes.
And you recall speaking with the prosecution on May 16th of 2015, is that right?
16th. Yes.
Okay. And I believe you had your lawyer present, is that right?
Yes.
Okay. Did you bring your lawyer with you to court today?
She's here, yes.
Yes. Here in the courtroom?
No.
Okay. When you spoke with the prosecution on May 16th of 2015, while you talked to them about your conversation with Dr. Fenton, you never mentioned anything about talking to Dr. Roth, isn't that correct?
I don't recall, honestly.
You had actually an opportunity, I think it was the district attorney's investigator, Mike Heelan, that forwarded that report to your lawyer, and you reviewed it with your lawyer?
Yes.
Okay. And you didn't add anything in there about Margaret Roth, is that right?
That's correct.
Okay. Now, with regard to Margaret Roth, you didn't review any of her notes or her report, is that correct?
Not at the time, no.
Okay. And in fact, you didn't take any notes of your meeting with Dr. Fenton, is that right?
That's correct.
And you didn't take any notes of your review or meeting with it's not doctor, but Margaret Roth, correct?
Correct.
And you never took really any notes of your meetings with Mr. Holmes, is that right?
That's correct.
And any of your kind of pre-appointment, post-appointment meetings with Dr. Fenton, you didn't take any notes?
Correct.
In fact, you really don't have any notes with regard to any of your meetings or work with Mr. Holmes, is that right?
Yes.
Okay. Now, I want to talk a little bit about what you knew before you met with Mr. Holmes. Because I'm assuming it was important for you to have some background information first.
Sure.
Okay. Now, you knew that Mr. Holmes had expressed thoughts of killing people?
Yes.
Okay. And in fact, he did that at his very first intake appointment with Margaret Roth. Isn't that correct?
Yes.
Okay. You knew that these were kind of obsessive thoughts for him? That's how Dr. Fenton put it?
Both Dr. Fenton and Ms. Roth.
Right. And that he had been cagey was a word that Dr. Fenton used with regard to details of these thoughts. Is that right?
Yes.
Did she also indicate to you that Mr. Holmes had told her when he got glasses he wanted to overcome biology?
I had heard that, yes.
Okay. And that the solution to the biological problem for him was homicide?
I had heard that, yes.
Okay. And Dr. Fenton really didn't quite understand what that meant. Is that right?
Correct.
Okay. She was concerned about possible psychotic thinking. Is that correct?
Yes.
Concerned that Mr. Holmes was possibly shifting into a frank psychotic disorder such as schizophrenia.
Yes.
Okay. And I think part of the eventual differential diagnosis was that Mr. Holmes may fall within the schizophreniform disorder. Is that right?
Yes.
Okay. Did she tell you that Mr. Holmes had thoughts of killing as many people as possible?
I don't believe I heard that, no.
Okay. So when she indicated that in her final report of June 11th, that's not a statement that you're familiar with at all?
After the July 20th event, I became familiar with it, but not at the time.
Okay. So when you reviewed her July 11th report that came out of that last meeting and the beta team investigation, that statement in there was not something you had been familiar with prior to then?
Correct.
I think you said July 11th. Did you mean June 11th?
I did, I'm sorry, June 11th.
Okay.
Not you, her.
Okay, I meant June 11th. Okay. So let's, I just want to cover a little bit with you about your 6 sort of listed reasons to be involved here, all right? I understand that, I think one of the, and I may not go in order, but you talked about the need to help Dr. Fenton with her differential diagnosis. Is that right?
Not so much to help her, but to give my opinion as to my view of his differential diagnosis.
Well, Dr. Fenton had indicated to you that diagnosing Mr. Holmes, and I think the word she used was confusing for her. Is that correct?
Yes.
Okay. You also, let's talk a little bit about the medications. You said yesterday, and I think even just a few minutes ago, that you felt, and the medications we're talking about at this point in time when you are seeing Mr. Holmes is the sertraline, correct?
Yes.
And the I can't say it, propranolol?
I believe that he had discontinued those meds by the time I entered into seeing him.
He had discontinued the sertraline?
No, the propranolol.
And went to
Clonazepam.
Thank you. Is that correct?
I believe he was still on that medication.
Okay. So when you are thinking about those medications and discussing them with Dr. Fenton, she had indicated to you that, in fact, he had become a little bit more relaxed in some of his social interactions as a result of those medications?
Yes.
Which you think was appropriate, is that right?
Yes.
Okay. Now, still, though, well, let me ask you this. Dr. Fenton had prescribed those medications with regard to anxiety. Is that what she told you?
Obsessive compulsive symptoms and social phobia.
Okay. And social phobia include, I guess a lay term for that would include anxiety. Is that right?
Anxiety in social situations.
Right. And so those medications that she had prescribed, in your opinion, were working for those two things?
Yes.
Okay. Now, you said yesterday that, you know, despite the fact Well, let me ask you this. I mean, despite the fact that you think these medications were working, isn't it true that on May 31st you still suggested an antipsychotic medication to Mr. Holmes?
Yes.
And that, I think you said, was risperidone?
Yes.
Is that also Risperdal?
Yes.
Okay. Now, you said, yesterday that what you had done with Mr. Holmes was you kind of listed for him all the ways that that medication could help you.
Yes.
Okay. And you recall again in your meeting with the prosecution on May 16th of this year, when you spoke with the district attorney and their investigator, you recall that meeting?
Yes.
And you didn't really mention anything to them about sort of listing out all the specific reasons you gave to Mr. Holmes for that medication. Is that correct?
Correct. I don't remember being specifically asked about that.
Okay. And you reviewed that report and didn't add anything about that, correct?
Right.
Okay. What you indicated simply was that you offered him the medication and he didn't want to take the antipsychotic medication.
Right.
You had the thought that he probably knew maybe some of the side effects of an antipsychotic medication.
Yes.
Okay. And those side effects can be kind of problematic and difficult to manage. Side effects people wouldn't want, generally.
Possibly, but not automatically.
And that's why you thought maybe he didn't want to take that medication. Is that right?
No. I had the impression, the defendant was a neuroscience student, and I had the impression
That he knew about the side effects.
that he had read everything there is to know about every single medication he was on, and he had his reasons.
But you didn't ask him that specifically. What have you read about medications?
I did not.
What information do you have about these medications?
I did not.
What do you know about the side effects of these medications? Didn't ask him that.
Did not.
Okay. So this is something that you just simply infer. Is that right?
Yeah.
Okay. Now, nonetheless, some of the reasons that you felt an antipsychotic might still be good for Mr. Are you aware that that's the antipsychotic medication that they eventually did put him on?
No.
Oh, okay. That those medications help, I think some of the things you listed yesterday, that it helps with a psychotic process. Is that right?
Yes.
Okay. Helps with delusions.
Can. Yes.
Okay. Now, another reason you said you were going to go help Dr. Fenton was you're trying to assess this therapeutic relationship.
Yes.
Okay. And Dr. Fenton was concerned that, in fact, this therapeutic relationship between her and Mr. Holmes wasn't really all that strong.
Yes.
Okay. And perhaps one of the problems there was on her, by his fourth visit, her fourth time meeting with him, she actually didn't even get his name right when she wrote a prescription. Is that right?
She made a mistake on the prescription.
Right. She didn't get his last name correct. That was the mistake.
Yes.
Okay. I understand that not only were you evaluating her therapeutic relationship with Mr. Holmes, but you're also investigating a potential for you to develop a therapeutic alliance with Mr. Holmes.
Yes.
Correct? And because of your focus in kind of creating this alliance, you weren't necessarily always focused on getting a full history.
That's right.
Okay. And because you're sort of focused on the alliance, there were some things that you just didn't talk to him about, like the trichotillomania.
Correct.
Okay. And I don't believe you discussed body image with him. You didn't bring up those ideas about overcoming biology. Is that correct?
That's correct.
Okay. So when you testified earlier, when Mr. Brockler was asking you questions, that Mr. Holmes didn't tell you about body image, I mean, you didn't really ask him about that. Is that fair?
Yes.
Okay. Now, let's talk just a little bit about your kind of your goal to assess the need for an involuntary commitment. That's also a 72-hour hold. I think you've used that term. Is that right?
Mm-hmm.
Yes?
Yes.
Okay. So Dr. Fenton, when she spoke with you as early as April 23rd, had concerns that a 72-hour hold might be appropriate. Is that right?
Sure.
Okay. and she was unsure of what she should do.
She was evaluating what to do.
Right. So she didn't have a sure, definite decision on what to do.
Correct.
Okay. And a large part of that was due to the homicidal ideation that Mr. Holmes had admitted to from the beginning. Is that right?
I'm not sure.
Okay. Did she indicate to you that she was very concerned with what she was hearing with regards to the homicidal ideation?
She indicated she was concerned. She didn't indicate that that was her primary concern.
Right, because I understand what her thought is and your thought is that the primary reason for the therapy was the anxiety and the OCD, right?
Yes.
Despite the fact that Mr. Holmes had told you all about homicidal ideation from the very
Was more a danger to himself or others versus obsessive compulsive thought process.
or even, quite frankly, I think you've indicated part of a delusional process.
That was a question.
Okay. And that could also be part of a psychotic process.
Yes.
Okay. Now, you said developing the therapeutic alliance is something that's really important to you.
Yes.
I mean, important to the sort of efficacy of treatment.
Yes.
Right. And sometimes, isn't it fair that it takes a while? You don't necessarily expect to develop a therapeutic alliance with a patient in like 2 minutes.
You hope to start it in 2 minutes.
Right. But it can take sometimes multiple visits with a patient to do that?
You bet.
Okay. And when you met with Mr. Holmes on May 31st of 2012, that was the very first time you had met him ever, correct?
Yes.
Okay. Now, with regard to the therapeutic alliance, you indicated earlier that sometimes if you do a 72-hour hold, that might break a therapeutic alliance or prevent you from ever creating a therapeutic alliance. Isn't that fair?
Yes.
Okay. But sometimes it is important to break that when the safety of your patient is really of concern to you.
Of course.
Okay. And sometimes it's important to do that, especially if the safety of others may be of concern to you.
Of course.
Okay. And in fact, Dr. Fenton, when she contacted Mr. Holmes' mother against his wishes, and that had the potential of breaking a therapeutic alliance, if you found out about it.
Well, the therapeutic alliance was already broken when he terminated his care with us.
Right. And I know you didn't feel, and Dr. Fenton was concerned about her therapeutic alliance with him, but she went against his wishes to call his mother out of concern for safety. Is that fair?
Yes.
Okay. And in fact, I think she indicated she even broke the rules of confidentiality under HIPAA.
I don't know whether she indicated that or not, but this was not a HIPAA violation.
Now, when you talked to Dr. Fenton on April 23rd, an appointment for you and her and Mr. Holmes had not yet been set. Is that right?
Right.
Okay. What you decided was that she would speak to Mr. Holmes about bringing you in. Is that right?
Yes.
Okay. Which she did. Is that right?
Yes.
On, I believe it was May 1st.
I believe so. I don't know the specific date.
And then she indicated to you, hey, we have a possibility of this appointment on May 22nd, somewhere around that date.
Okay. Yes.
Now, the first date that she gave you that she had scheduled Mr. Holmes, I understand you were not available.
Right.
Okay, you had to email her back and have her reschedule.
Yes.
Okay. When she again spoke with Mr. Holmes, she gave him a list of 3 other dates. Are you aware that he chose the very first date she gave him?
I'm not aware of that, no.
Okay. Nonetheless, that didn't end up being until May 31st, correct?
Yes.
Okay. Now, Mr. Holmes was really Dr. Fenton's patient, and I think that you've indicated that it was Dr. Fenton's choice for how urgent you all were going to deal with Mr. Holmes. Is that right?
Yes.
Okay. You talked a little bit yesterday, well, and some today, about patients withholding information from their doctors. So I'm going to talk to you a little bit about that, ask you some questions about that, okay?
Yes.
Now, in psychiatry, when you're treating a patient, I mean, you have to rely on your patient. Is that fair?
Yes.
Sometimes, especially over the long-term course of treatment, you may try to rely on collateral information to sort of confirm or deny, help you evaluate what your client's telling you.
Yes.
Okay. But what is, it's not, I don't want to use a double negative. Isn't it fair that it can be common for patients, especially in the outset of treatment, to not want to tell you, their doctor, everything?
Sure.
Okay. And I mean, sometimes they're kind of really embarrassed about what they're thinking,
Yes.
embarrassed about what they're feeling,
Yes.
and they have a hard time opening up completely. Is that fair?
Yes.
They have a hard time sometimes even communicating.
Yes.
And in fact, there's certain illnesses where inability to communicate is one of the features of those illnesses. So that could have an effect on their ability to talk to you, correct?
Yes.
Okay. It is also not uncommon. It can also happen that a particular doctor ends up just not being a good fit for a particular patient.
Yes.
Okay. They're really no fault of the doctor or patient. It just didn't work.
Yes.
Okay. Now, when you're trying to diagnose a patient, isn't it fair that sometimes it can really take months sometimes to collect all the information you need to come up with a particular solid diagnosis?
Yes.
Okay. And some diagnoses actually require that symptoms be in existence for like at least a 6-month period of time.
Yes.
Okay. And so in order to get to that type of diagnosis, you would either have to have a complete history back that full period of time or have seen that patient over that course of time.
Yes.
Okay. Now also, you find that it is common or it happens with some frequency that patients can be a little bit ambivalent about treatment, like they want help, but then they don't want help.
Yes.
Okay. You led the treatment session on May 31st, correct?
Yes.
And I understand you said that you and Dr. Fenton did some speaking on June 11th, but you were also kind of trying to lead that treatment session as well?
We decided to be jointly led.
Okay. With regard to the treatment session on May 31st, though, you pretty much did all the talking, and for both sessions, you really relied on Dr. Fenton to take notes. Is that correct?
Yes.
Okay. Now, I believe your approach with Mr. Holmes was to work from a mentalization standpoint?
Yes.
Okay. And a transference standpoint?
Yes.
I want to now directly talk about some of the conversations you had with Mr. Holmes on May 31st of 2012, okay?
Yes.
Now, yesterday what you told us was that you began by asking him if he knew why I was there, and he said he knew I was there because Fenton had asked me to join. Is that correct?
Yes.
Thank you. Now, he also told you, isn't it correct, that he thought you were there because Dr. Fenton was scared of him?
Yes.
Okay. You were aware of some kind of previous interactions that Mr. Holmes had with Dr. Fenton about her locking the door and him believing he was protecting herself from him?
Yes.
Okay. And that he had mentioned something about a conspicuous package behind a chair?
That came up in that session, I believe.
Right. Something that Mr. Holmes brought up?
Yes.
That he thought there was a package behind her chair that had something to do with him?
Yes.
Okay. And he was a little bit paranoid about that?
I wouldn't use that word.
Okay. Well, did Dr. Fenton indicate to you how odd and bizarre she thought that those statements were?
She thought they were unusual a little bit, yeah.
Okay. She didn't use the word odd and bizarre with you?
No.
Okay. And she didn't tell you that she thought they reflected paranoid thoughts?
She did use that word,
Okay.
but that wouldn't be the word that I would use.
Well, you did indicate to the district attorney on May 16th of this year that you, in fact, were worried about Mr. Holmes being paranoid and suspicious.
I would say that I was aware that he was vigilant, meaning watching the environment, checking us out, looking around the room. I wouldn't call that paranoid. I may have said paranoid, but that isn't what I meant.
Okay, well, you did have an opportunity to review that report and make corrections to it, and you didn't change the word paranoid to vigilant on that report. Is that correct?
Just to remind you, that report was taken by someone who works for the prosecution's office. That was not my report. It isn't in my words. It was his summary of my words.
Right.
So I don't know exactly what was his interpretation of what I said versus what I actually said. And my feeling about it was that I didn't want to go line by line evaluating someone else's view of what I said. That I didn't think that was my role or wish.
But you don't deny, Dr. Feinstein, that the prosecution's investigator sent this report to your lawyer, correct?
Yes,
And that you and your lawyer had an opportunity to review it, correct?
we reviewed it, yes.
And that you had an opportunity to provide corrections or changes to this report to the prosecution. Is that correct?
Yes.
Okay. Now, you have said that, did Dr. Fenton tell you that when she approached Mr. Holmes in that May 1st meeting about you coming into the session, that his response to her was that you were going to come in to lock him up?
Yes.
Okay. And that was a thought that he had brought up with her on several occasions throughout some of her appointments with him. Is that right?
Yes.
And in fact, that is also a thought that he brought up with you, correct?
Yes.
Now, I think yesterday when you talked about that, you said, well, you know, that movie, One Flew Over the Cuckoo's Nest, it's not uncommon for people to come in and think we're going to lock them up. Is that right?
Yes.
Did you ask Mr. Holmes if he had seen that movie?
No.
Did you ask Mr. Holmes if he had this just general thought about all psychiatrists locking him up?
No.
No. Fair to say that someone also might be worried about their psychiatrist locking them up if they were, say, planning on hurting other people?
Possibly.
Yeah. And it's not unusual for a patient to avoid saying things that might get them locked up. Is that correct?
Correct.
You spoke yesterday about some other things beyond just sort of homicidal ideation that you felt that Mr. Holmes, I think your words were, didn't provide a lot of answers about. Do you recall that?
Yes.
One of the things you mentioned was his girlfriend.
Yes.
Is that the ex-girlfriend that he had broken up with that he had been talking to Dr. Fenton about?
Ex-girlfriend and somebody else who he was seeing subsequently to that.
Okay. Now again, when you talked to the district attorney on May 16th of 2015, you talked to them about things like the homicidal ideation that Mr. Holmes was cagey about, but you didn't really mention the girlfriend or the ex-girlfriend as one of the things that he did not want to talk to you about.
I don't recall whether I mentioned that or not.
In fact, Mr. Holmes actually did tell you several things about the ex-girlfriend in that relationship. Isn't that right?
Not much, but some things, yeah.
Yeah. He said that relationship didn't last that long. His relationships, didn't last that long.
Right.
That he doesn't attach to people, that people attach to him.
Yes.
Okay. And he also told you that even after the breakup, he had mentioned to her about sort of his hatred of mankind?
At some point, I knew about that information. I can't place a time on it.
Okay. If that was in Dr. Fenton's notes from May 31st that he said that, would that be more accurate than your memory if she wrote it down?
Sure.
Okay. One of the reasons why you felt it was important to talk to him about his attachment to people, and that it was helpful when you heard him say he didn't really get attached to people, is because that's one of the many traits with the diagnosis within the schizophrenia spectrum. Is that correct?
May or may not be, but yes.
Yes. Now, the other thing that you said that Mr. Holmes, or yesterday you said that Mr. Holmes didn't want to provide a lot of information about, was about his schooling. Now, when you talked to him on May 31st, he did tell you, actually, let me just back up one second. With regard to the girlfriend, what you actually told the prosecution on May 16th was that you did not talk to Mr. Holmes that much about his girlfriend, about that topic.
Both ways. I didn't talk that much, primarily because when asked, I didn't get much of an answer.
Okay. When you talked about schooling with him, he did indicate, even on May 31st, that he was concerned that school was not a good fit for him.
Yes.
Okay. And when he talked to you about school on July 1st, because on May 31st he hadn't had his preliminary exam. Is that fair?
Right.
Okay. So when he talked to you on June 1st, after the preliminary exam, he admitted up front he didn't pass it.
When asked, and it was actually June 11th.
What did I say?
First, I believe.
Sorry, June 11th. When you asked him, he told you
Yes.
that he didn't pass.
Yes.
He told you that he'd be dropping out of school.
Yes.
And he told you that he kind of had taken a year off between undergraduate and graduate school, so he had been there before?
Yes.
Okay. So yesterday, when you said he did not want to provide a lot of information about school, he actually did, over the course of both of your appointments, provide you some information about his school. Is that right?
Minimal in my view.
Okay, in your view. Now, you also said that he didn't want to talk to you about who his friends were. Is that right?
Yes.
Did you even know if he had any friends at that point in time?
There were references to a girlfriend, but no name. I didn't know her name. There was reference to some woman he was seeing afterwards. Didn't know a name.
That's the girlfriend, the person he was seeing, the girlfriend. You didn't know her name.
Didn't know her name.
But you didn't even. I mean, he may not have had any other friends to tell you about at that point in time.
Well, he referenced that he had friends, but no. That's what I mean about not getting information. I didn't know names. I didn't know where he met them. I didn't know whether they were in his class. I didn't know if they were close friends or distant friends.
Mm-hmm.
And when I tried to get a feel for that, I got those same kind of misdirections, nods, non-response that I've described previously.
So you've mentioned this now and explained it to the jury. It's not something you really ever mentioned to the district attorney on May 16th of 2015, that he was not forthcoming with you about who his friends were. Is that correct?
It's not whether I mentioned it. I responded to their questions, and if they asked about it, I would respond to it. So it's not that I omitted it or didn't mention it. I responded to their questions like I'm responding here.
Dr. Feinstein, did they prevent you from adding information if you had wanted to?
Not prevented.
Okay. On May 31st of 2012, another topic that you got into with Mr. Holmes was his sort of hatred of humanity.
Yes.
Okay. And I think that you sort of took that as a generalized hatred of mankind, of humanity, right?
Yes, I mostly was thinking about it as an obsessive thought.
Okay. Now, what you had, I think, said yesterday is that for you, the word hatred itself didn't have a lot of force behind it.
Yes.
Okay. Didn't carry a lot of affect.
Yes.
Didn't carry a lot of emotion.
Yep.
And for those reasons, I guess it concerned you a little less. Is that?
Yeah, because the sort of absence of emotions are typically associated with obsessive thoughts.
Okay. Now, Dr. Feinstein, you've also said that overall Mr. Holmes pretty much had a flat affect. Is that correct?
Yes,
Okay. So not just with regard to those statements, but with regard to how he presented in general, correct?
yes,
Okay. And I understand that having a flat affect can also be a symptom of some mental illnesses. Is that fair to say?
many things, yes.
Yes. You said that Mr. Holmes did not tell you he had any hallucinations.
That's right.
Okay. Now, my understanding is you did ask him about sometimes ever seeing things that were not there.
I believe Dr. Fenton asked that question in the June 11th timeframe.
So when you indicated to the district attorney on May 16th of 2015, he did ask him about sometimes ever seeing things that were not there. What you meant was Dr. Fenton asked him that?
I believe so.
Okay. Nonetheless, the answer was not a yes or no answer, correct?
It was not a clear answer, correct?
I think the response was he did not give a yes or no answer, correct?
That's what I recall.
Okay. So he didn't deny it. He didn't affirm it. So you had no answer with regard to whether he saw things that weren't there in that exchange, correct?
Correct, we didn't know.
Okay. Do you recall, I know that you said that Mr. Holmes had good eye contact with you at least at the beginning of the May 31st appointment.
Yes.
Did that continue all the way throughout, or did that drop off?
It continued, in fact, got even better and more connected when we were talking about his philosophy and when he asked me about my philosophy of life.
Okay.
That was the time that I felt we were most connected.
Yeah, that was a time that you told him that one of your reasons for doing what you're doing is to help suffering.
Yes,
And you felt that struck a chord with Mr. Holmes.
I did.
Okay. Do you recall talking to Dr. Reed on July 25th of 2014?
Yes.
Okay. And you did that over the phone, is that correct?
Yes,
With Dr. Fenton?
correct.
Okay. And do you recall that over the phone you all indicated that Mr. Holmes had actually poor eye contact most of the time?
I don't remember.
Looking down around the room, sometimes quickly?
I don't recall. I don't
Gazed
recall.
away, but not as if gazing in thought. It was an odd gaze.
I don't remember those words myself, but it's possible Dr. Fenton may have said that.
Okay. And you were on the phone with her, and so if you had disagreed, you would have said that at the time.
She and I were in a room together on the phone with
Like
Mr. Reed.
Like a
In-
speakerphone?
Yeah.
Okay. I think it was also indicated that when subjects got personally close, that Mr. Holmes tended to become more still and to stare.
I think the word was stilted, not still, but stilted.
And stare?
Yeah.
Okay. And one of the things that you suggested to Dr. Reed is that, in fact, he should just explore a probable delusional system. Is that right?
Sure.
Yeah.
We were concerned about that.
Okay. You mentioned this idea of sheeple yesterday. Is that a yes?
Yes.
Thank
sorry.
you. Now, was it your interpretation of it, sheep and people?
It was my, the way it was said and what we discussed, yes, that it was a condensation of people and sheep.
Is that something you specifically asked him to define for you?
I believe, yes.
Okay. You also talked, oops, that was loud. You also talked about Nietzsche, the Tylenol terrorist, Kaczynski. Now, this was when you talked about speaking with Mr. Holmes about this, you put it in the context of discussing philosophy. Is that right?
I felt that he was telling me about the philosophies that he was interested in.
Okay. He didn't specifically say, I'm reading these books because these are philosophies I'm interested in. No. And you didn't specifically say, boy, you're interested in the philosophies of these people. That's why you're reading these books. Is that right, Mr. Holmes?
Correct. I did not say
Okay.
that.
So for you, the way you recall it is he didn't talk about reading those books in response to your question about what else does he do in his free time.
Correct.
Okay. It wasn't on the heels of him talking about playing Diablo 3 for 100 hours the previous couple weeks.
Correct.
It wasn't on the heels about him talking about studying for exams.
Correct.
Okay. Wasn't on the heels of him talking about getting addicted to video games.
Correct.
Okay. And in fact, Mr. Holmes, you said earlier, responded to you by saying, what's your philosophy on life?
Yes.
That was a question he had also asked Dr. Fenton, correct?
Yes.
Okay. And she was quite confused by that because he was saying, I've told you mine, why don't you tell me your philosophy? And she hadn't really understood him to tell her his philosophy. Were you aware of that?
Yes, that's what she mentioned, yes.
Okay. And other than the conversation you've already discussed, you didn't really ask him too much more about reading those particular books. Is that correct?
Yes.
We talked a little bit earlier about Mr. Holmes generally having quite a flat affect.
Yes.
Would you also, is it fair to say that he generally spoke in pretty short sentences?
Yes.
One-word answers?
Yes.
Okay. That can also be kind of part of a symptom of certain mental disorders, having that sort of paucity of speech.
Yes.
Okay. This is a little bit out of order. Was your arm in a sling for one of these meetings with?
Yes, it was.
Do you remember which meeting it was?
It was the June 11th meeting.
Okay. You had some sort of surgery and your arm was in a sling?
I had wrist surgery.
Okay. Now, ultimately, at the end of that May 31st meeting, subjectively, that meeting felt worrying to you.
Actually, it felt reassuring to me because I felt that I might have a chance at developing an alliance with him and that I might be able to engage him in treatment.
Okay. Do you recall indicating to the district attorney that subjectively he said it felt worrying, there was a tenseness in the room?
I'm sure from time to time we were concerned and felt tense. I'm sure that's true as well.
And while you, I guess, has felt you started developing some sort of therapeutic alliance, you did not know what was going on with Mr. Holmes, even at the end of that meeting.
I knew more than I did before the meeting, but no, we didn't know everything that was going on with him.
So I want to talk a little bit about the June 11th meeting, and then we'll hopefully wrap up a little bit.
Okay.
He agreed to come back.
He did.
Right? Okay. And I think he agreed to come back, what is that, within 11 days?
Yes.
Quite a short period of time.
Mhm.
And you all didn't do any other meetings with him or medication check in between those 2 dates, correct?
I did not.
Okay. Do you know if Dr. Fenton did?
I don't know.
Okay. Now, when he talked to you in that June 11th meeting, we touched on this a little bit, but I want to follow up on one point. He talked to you about school not being a good fit for him and that, he was going to leave school. Is that right?
Yes.
And for you, it was shocking in your mind because he had spent so much time studying and getting to that point, right?
Yes.
But that was not something that he indicated was shocking or upsetting to him, correct?
He indicated it was relieving to him.
Right. And sometimes people get into graduate school and it's just really actually not a good fit for them, correct?
Yes.
And he didn't say anything to you like, oh my goodness, my purpose in life is over, nothing along those lines?
No.
Okay. Now when he talked to you, Mr. Brockler asked you about Mr. Holmes expressing to you that he still had a lease in Colorado.
Yes.
Now you kind of interpreted that to be sort of a financial commitment for him that he was going to fulfill.
A financial commitment and a willingness to stay in Colorado.
Right. And while he didn't have any specific plan at that time for work, I mean, quite frankly, that was the day that he was going to disconnect with the university and withdraw from the program, correct?
Yes.
Okay. When you and Dr. Fenton met after that appointment, you talked about activating the beta team, right?
Yes.
Still had concerns about Mr. Holmes.
Sure.
Yeah. And one of the things you discussed with Dr. Fenton was whether to ask or tell James Holmes' mother that he should come back and continue seeing you.
Yes, we wanted to encourage that.
Okay. But you didn't actually talk to his mother?
No.
Okay. And you didn't call her and tell her that?
No. Dr. Fenton made the phone call to his mom.
Okay. And while he indicated he didn't see a need for treatment and left, you were still hopeful he might come back?
Yes.
But you didn't do anything to directly follow up with him yourself, correct?
Correct.
You didn't call him, correct?
Right, because I was the consultant and that was Dr. Fenton's role.
Right. Didn't send him an email or anything like that?
No.
Okay. And did nothing with regard to the SSRI medication he was on, like make sure that he got some sort of tapering prescription or anything like that?
I trusted Dr. Fenton.
Okay. Now, you, sir, are aware that some victims in this case have filed lawsuits against the University of Colorado and Dr. Fenton in particular?
I am aware of that, yes.
Okay. And those lawsuits are kind of on hold pending this case?
Yes.
Okay. Now, I understand that your lawyer was present with you in that meeting with the district attorney, is that right?
Yes.
Okay. And at the end of the prosecution's questioning, it was your lawyer that injected a series of questions, is that right?
Questions, maybe clarifications, I don't remember questions.
Right. Many of them kind of directed at the quality of your care, is that right?
I don't have a specific recollection if that's how they were directed or not.
Ultimately, in the time that you spent with Mr. Holmes and knowing what you knew from Dr. Fenton, one of the things that you were trying to determine was whether these thoughts about homicidal ideation, about hatred of mankind, whether this was sort of part of a delusional system, is that right?
Yes.
Whether this was part of a psychosis, is that right?
Yes.
And ultimately, this was something that you could not make a determination on, is that right?
In 65 minutes of interviewing him, yes, that's correct.
Okay. So recognizing you had limited time, and Dr. Fenton also did not spend months and months with him. She had really only 2 full therapy sessions with him by the time that you were brought in, is that right?
Yes.
So ultimately, at the end of that, and you both felt that it was possible he was still delusional.
We were both, I certainly was worried that he might be in a long-term process of having a nervous breakdown, yeah.
Right, and so part of that was being delusional for you.
Could be.
Yeah, and that's one of the reasons why you suggested to Dr. Reed that he should explore the probability of a delusional system.
Yes.
Okay. And I understand that the differential diagnosis kind of that started with social phobia and OCD was expanded over the time of the treatment. Is that right?
Yes.
Okay. And it was expanded to include the possibility of sort of diagnoses that would include delusion and psychosis.
Yes.
Okay. It was expanded to sort of include schizophreniform spectrum disorders.
Yes.
Okay. And I think you said on several occasions, and talked to Mr. Holmes about your concern that he may be having what you called a nervous breakdown. Is that right?
Yes.
Okay. Now I want to talk to you sort of about what you just talked to the district attorney about everything that, or he asked you questions about things that Mr. Holmes did not tell you. All right?
Yes.
Specifically with regard to your questions about this, what you feared was a compulsive thought about hatred of mankind and this homicidal ideation that he expressed from the outset. Do you recall that line of questioning?
Yeah.
Now, isn't it correct that on May 31st, you talked to him about these concepts several times?
Which concepts?
The hatred of mankind, the
Yes.
homicidal thoughts,
Yes.
correct? And when he kind of related to you this hatred of mankind, you then sort of related that to the homicidal thoughts as well.
Yes.
Okay. And what you indicated yesterday is that when you asked him about this, he was evasive,
Yes.
gave you non-responses, correct?
Blank stares, non-responses.
Right. You asked him whether he still had homicidal thoughts, and from the way he reacted to you, you believed during the course of that appointment that indeed he did still have those thoughts.
Yes.
Okay. You were able to reaffirm with him that he wanted to hurt people as a result of these thoughts?
No, I never reaffirmed that. I asked him about target, place, time, person, but I never reaffirmed what you just said.
When you talked to the district attorney on May 16th of this year, you were asked, or you stated, isn't it correct, that when asked if he reaffirmed with the defendant that he still wanted to hurt people, he said yes. When you reviewed this, you corrected that from he said yes to he presumed that he did, he being you. So you presumed that he still wanted to hurt people. Is that correct?
Yes.
Now, with regard to that, you also continued to inquire further. Is that right?
Yeah.
And his response was he would sit blank.
He would sit blank, stare, nod, a variety of nonverbal movements, indications.
Right. It wasn't that he would deny it. He just was non-responsive.
My clinical experience suggested that sometimes these were denials, sometimes they were non-response, difficult to really tell.
Okay. He never specifically told you no. He just responded with blank stares. I think you've also described it as he sat in discomfort.
He pretty much never said no and never said yes.
Right. And when Mr. Holmes, your interpretation was when you started asking him questions into areas he didn't want to go, that was he would get uncomfortable. He would sit in discomfort.
Yes.
Okay. Continue to stare.
Yes.
Continue to be non-responsive.
Yes.
You said a moment ago, and I think you also said this yesterday, that at certain points when you asked him about the homicidal ideation and the hatred of mankind, that sometimes he would nod.
Yes.
And I think what you said yesterday is that one would have to interpret that like a head nod, correct?
Yeah. You
Okay.
have to use your clinical experience.
Right. And what you interpret a head nod from Mr. Holmes to be was a no answer. Is that right?
Sometimes no, sometimes yes, sometimes unclear.
Okay. Ultimately, you didn't know one way or the other.
Couldn't tell. No, not for sure.
Never really got a definitive answer.
That's correct.
And that really red flagged to you, made you worry that something was going on there.
Sure.
Right. And you told him you were worried that something may be going on there.
Sure. We had no doubt that he was withholding information, but we had no idea what information he was withholding.
You asked him again in that meeting about his homicidal ideation, is that right?
Yes.
And he did not deny the homicidal ideation at all.
Didn't deny it, didn't agree that he had it.
Actually, he told you that he was having homicidal thoughts 2 to 3 times a day.
I'm not sure that he told me that. Maybe he did. I honestly don't remember. Sometimes I get confused about what he told me and what I've read in the chart.
Okay. Well, what you indicated to the prosecution on May 16th of this year is you asked how often he was having thoughts, the homicidal thoughts, and he told you 2 to 3 times a day.
I probably asked about frequency, yeah.
You probably asked about frequency,
Frequency of his thoughts, of his ideation.
and he responded 2 to 3 times a day. Is that correct?
Yes.
Okay. He had the thoughts for a while. Told you that.
Yes, we knew
Okay. Now, despite that, what you interpreted that to be was fleeting. Is that right, Dr. Feinstein?
Yeah. Or fluctuating.
Well, the word that you used when you talked to the district attorney was fleeting. Is that correct?
I don't recall.
Now, you're worried about this, and when you tell him you're worried about these homicidal thoughts and ask him again about plans and weapons, again, you get a blank stare, correct?
Yes?
He stares off, looks into space, correct? Is that yes?
Yes.
Doesn't make eye contact with you, correct?
Correct. Sometimes made eye contact.
And it seemed to you that this was just a topic he didn't want to discuss.
One of many, yes.
Okay. Now you, I believe, indicated that you were hoping he would confirm these thoughts so that that would enable you to move on to the next treatment step.
Confirm what thoughts?
Well, you said you were hoping he would confirm so you could move on to the next treatment step.
I don't know what that refers to.
Okay. Now, when you spoke with him on June 11th, again, you talked to him about homicidal ideation, correct?
Yes.
Again, you got no answer,
Correct.
no story about what was going on,
Correct.
and you didn't push him on that because you were concerned about developing your therapeutic alliance. Is that right?
Yes.
And when you asked him about violence, one of his responses to you was that he was afraid you were going to lock him up. Is that correct?
Yes.
And also when you were talking to him about this, he looked somewhat nervous. Isn't that fair to say?
Yes.
Now, because you were concerned about, because it was obvious to you that Mr. Holmes was withholding some information, that he was being non-responsive, that he was being, I think it was put cagey, right? That he was not denying specific plans. That was one of the reasons why you decided to activate the beta team with Dr. Fenton. Is that right?
I want to make clear that my biggest concern was that he was having a nervous breakdown. It was a secondary concern that he might be violent, but my biggest concern was that he was having a psychotic episode, and that's where my area of concern was. Obviously, we had some concern about the meaning of the homicidal ideation, and we're trying to decide whether that was an obsessive thought or part of a psychosis. But our primary concern was that he was in the throes of a psychotic episode. Our primary concern was not that he was going to become violent.
I want to touch upon a question that Mr. Brockler asked you that about James never directly saying that he wanted to stop the homicidal thoughts.
He never said that to me.
Okay, did you ask him specifically, do you want these to stop? Are these painful for you? Is it making you suffer? Or is it hard?
I asked him if it bothered him, and the indication was he'd been having them for a long time.
Now, one of the things that he did ask you, Dr. Feinstein, was whether therapy could make him safe. Isn't that correct?
Yes.
And your response was that he was the one responsible. Is that correct?
Doesn't accurately characterize the conversation, but the words are there.
Okay. One of the things that you told him was that if he was suicidal and homicidal, that was something that was in his hands. That's what you indicated?
I was trying to make the point that he needed to tell us what he was thinking about, what he was doing, what he was planning, if he wanted us to keep him safe, and that his withholding information and not telling us about it made us more incapacitated in our ability to keep him safe. That was the thrust and the intention of that conversation, was to let him know that he was accountable for his own actions, his own behaviors, and that we could assist, but only if he was willing to share whatever it was that he was withholding from us.
I understand, Dr. Feinstein, what your intent was there. What Dr. Fenton wrote down that you said was that you couldn't really prevent suicide or homicide in the long run. The person was intent on it.
If that's what she wrote, then that's what she wrote.
Okay. And she was the only one taking notes of that meeting, correct?
Correct.
Okay. One of the things that you also indicated to him, that he needed to be accountable for his own thoughts,
Yes.
and that indeed you could not fix him.
That we couldn't fix him without his cooperation.
Dr. Feinstein, I have no further questions for you. Thank you.
Is there any redirect?
Yes, Your Honor, thank you. Hey, Doctor, I want you to do me a favor and tell me, did you ever get enough information from the defendant to make some sort of definitive diagnosis?
No.
How about even whether or not he was suffering from a delusion?
We were unclear about that.
Go through a list for us, if you would, of everything that was an indication to you that this guy, when he walked out of your office, or Dr. Fenton's office on June 11th, lacked the ability to make decisions.
Um,
Is there anything?
I didn't see anything that's...
I would object. That calls for speculation, and this is outside the scope of cross-examination.
It's within the scope, but why don't you rephrase the question? I'm not sure I understood the question, so I'll sustain it as to the form of the question.
Yes, sir. Did you see anything in your time with the defendant that led you to conclude, as he walked out on June the 11th, that he lacked the ability to make rational, logical decisions for himself?
No. I believed he could make rational decisions.
Was there anything he told you that indicated he couldn't make rational, logical decisions for himself?
No.
When you talked to him about really the decisions that he made about what he was going to do, suicide, homicide, or whatever thoughts he had being in his hands, did he ever seem or look to you to be confused by what you were telling him?
No.
Did that get him to give you any more information?
No.
How is it that if someone doesn't answer your questions, you just don't treat that as, well, that's it, I'm locking them up because they won't answer my questions? In your 30-plus years of practice, isn't that what you pretty much do?
People don't answer all kinds of questions. I don't lock them up. If I don't understand what's going on, I try to understand it over time.
Does that include people, as you've testified before, the many people that have come to you who have expressed some even more detailed homicidal ideations than the ones the defendant gave?
Yes.
You were asked by Ms. Higgs about ambivalence regarding treatment. What does that mean?
It means he wants help and he doesn't want help.
Did you see that with the defendant?
Yes. The part of us that felt he wanted treatment was that he was coming, and he came to 8 sessions, which signaled, help me. And the part that signaled he was ambivalent about it was his questions about what would therapy do, his unwillingness to follow our recommendations for additional medications. So we felt also the occasional anger he expressed, we felt that he both wanted to be there and didn't want to be there.
Now, Ms. Higgs also asked you a list of things that might cause someone to not want to answer your questions or be candid with you, including whether someone would be embarrassed, nervous, ashamed, or whether or not some potential mental illness would keep them from being more forthcoming. Did you remember that?
Yes.
As long as you're being asked to speculate about all the reasons, could another reason be that someone had set their mind on committing a mass murder and they didn't want to share with you the details of that information because they thought...
Okay.
Object to the form of the question is argumentative.
You're asking him if that's a possibility? All right, the objection is overruled.
I'll just start over. Is it also possible that someone could have set their mind on committing a mass murder and they didn't want to share with you the details of that for fear that you would prevent them from carrying that out?
Yes.
In fact, let's just go big here. I mean, if we do what's being suggested and you had even put him on a 72-hour hold, would that have prevented him from committing a mass murder some 7 weeks later?
Your Honor, objection, speculation.
Why don't counsel approach? Thank you. All right, the objection is sustained, and Mr. Rockler, you may proceed.
Thank you. Let me ask you a more general question. Is one of the other reasons that someone may not be forthcoming with you about information because they're planning on doing something wrong and they don't want to tell you about it?
Yes.
And you won't know unless they tell you why they're not telling you.
Correct.
Doctor, who was it that didn't answer the questions with greater detail about homicidal ideation?
Mr. Holmes.
Who was it that didn't agree to take any antipsychotic medications?
Patient, Mr. Holmes.
Who agreed not to give you any details of the weapons that they'd purchased or the plans that they'd made leading up to June the 11th?
Mr. Holmes.
Who rejected the offers at continued mental health treatment or therapy for free to address whatever problems may exist?
Mr. Holmes.
And who got up and walked out of your office on June the 11th prior to the end of even that last session?
Mr. Holmes.
I have nothing for you.
Is there any recross?
Just briefly, Your Honor. Dr. Feinstein, who was it that initiated this mental health treatment?
Mr. Holmes.
Right. Who was it that talked to Margaret Roth and expressed up front that he had thoughts about killing people?
Mr. Holmes.
Who was it that showed up at all of his meetings, all of them scheduled with Dr. Fenton?
Mr. Holmes.
Who was it that took religiously the SSRI medication that she prescribed to him?
Well, Your Honor, that calls for speculation.
Doctor, you can't speculate, so if you can answer the question without speculating, go ahead and answer. Otherwise, you can't answer the question.
Could you rephrase it again, please?
Who was it that told Dr. Fenton that he was taking the medication that she prescribed to him, the SSRIs, the propranolol, and the clonazepam?
I don't know. I can't
Okay.
answer. I can't answer. I don't
Who
know.
was it that asked if your therapy could make him safe?
Mr. Holmes.
Right. And who was it that told him that they could not fix him? That was you, Dr. Feinstein, wasn't it?
I didn't say we couldn't fix him. I said we couldn't fix him without his active participation and cooperation.
Thank you, Dr. Feinstein.
All right, it looks like the jury may have some questions, Doctor, so if you would give us a moment, please. Thank you. Thank you. Okay. All right, members of the jury, it looks like there are a few questions here, and in any event, one of you, or perhaps more than one of you, needs a break. So let's go ahead and take our afternoon break, and then I'll take advantage of that time to talk to the lawyers about the questions, all right? Please remember my advisements during the break. They all apply. Let's plan on about a little bit of a longer break because I have some things to do during the break. So let's plan on about a half-hour break for you, okay? Thank you. And doctor, I'll have you step out for a moment, please. Please be seated, everyone. The records reflect that the jury has exited the courtroom now. All right, the record should reflect that not only are we outside the presence of the jury, but we're also outside the presence of Dr. Feinstein. The jury has submitted some questions for Dr. Feinstein. The first few questions are on the form that I have marked as number 190. The first question is, have you had in your years of practice a misdiagnosis with a patient that then the patient became violent? What's the people's position, Mr. Brockler?
The objection, Your Honor.
What's the defense's position, Ms. Higgs?
Your Honor, I don't have an objection.
All right, without objection, I'll ask it. The next question is, if you were aware that he had a disregard and or dislike of Dr. Fenton, why didn't you see Mr. Holmes without her presence? Is there any objection, Mr. Brockler?
No, sir.
Any objection, Ms. Higgs?
No, Your Honor.
I'll ask it without objection. The next question is, what are the side effects of Risperdal? Is there any objection, Mr. Brockler?
Sir.
Any objection, Ms. Higgs?
No, Your Honor.
All right, I'll ask it without objection. The next questions are on the form that I have marked as number 191. The first question on that form is, if someone comes to you with homicidal thoughts / ideations, is it common for the patient to ask for help in getting rid of those homicidal thoughts? Is there any objection, Mr. Brockler?
No, Your Honor.
Is there any objection, Ms. Higgs?
Your Honor, I would object on grounds of speculation, foundation, and I would also renew my objection about going into areas of Dr. Feinstein talking about his sort of experience and treatment of other patients as opposed to Mr. Holmes.
Any response, Mr. Brockler?
All right, it feels like the cross-examination ran pretty far down the road with his experience and expertise, especially in some of those general questions we talked about, both in the courtroom, in open court, and up at the bench. This is obviously an issue that the jury's interested in. It was touched on by both sides. I think it's not only relevant, it's necessary.
You know, it's not a question that's calling for speculation, so that objection is overruled. The objection about whether foundation is lacking is overruled as well because he is a psychiatrist and he was one of the treating physicians for the defendant. And the last objection is to Dr. Feinstein talking about his experience and treatment of other patients, and I have overruled that objection yesterday, I think it was, and I continue to have the same position. Both sides have asked questions about the defendant's comments with respect to homicidal ideation and having homicidal thoughts, and why Dr. Feinstein didn't did or didn't do certain things, and what steps he took and what steps he didn't take. And so I think it's fair for him to be asked how this compares to other patients. It goes to why he took certain actions or didn't take certain actions, and this question is asking specifically whether it's usual or unusual for someone who's having homicidal thoughts or ideations to be asking for assistance to get rid of those homicidal thoughts. So I think it's relevant based on the testimony that was elicited by both sides, and I think it's appropriate, so I will ask the question over the defense's objection. Next is, does a person have to meet certain criteria for an involuntary medical hold, or can a psychiatrist put a patient on a medical hold because of a gut feeling? Is there any objection, Mr. Brockler?
No, sir.
Is there any objection, Ms. Higgs?
No, sir.
That's an appropriate question, so I will ask it. Next, I have the form that I have marked as number 192. It contains two questions. The first question is, what is the full list of criteria that must be met to place someone on a 72-hour mental health hold? And is it subjective? Is there any objection, Mr. Brockler?
No, Your Honor.
Is there any objection, Ms. Higgs?
I would just note it's probably cumulative, but no objection.
It may be cumulative, and I may ask him if he's already answered it, and he can tell me whether he has or not, and then if he has, we'll move on. The next question on the same form is as follows. If you had concerns with James Holmes's homicidal thoughts, yet he didn't meet the criteria for involuntary 72-hour hold, did you ask him if he would go into a hospital willingly? Is there any objection from you, Mr. Brockler?
No, sir.
Is there any objection from you, Ms. Higgs?
No, sir.
I think that's an appropriate question, so I will ask it. And finally, we have a question on the form that I have marked as number 193. You indicated in your testimony that a paucity of speech, stilted speech, and inability to communicate are symptoms of a mental disorder. What disorder or disorders are you referring to? Is there any objection, Mr. Brockler?
No, Your Honor.
Is there any objection, Ms. Higgs?
No, sir.
All right, I think that's an appropriate question as well, so I will ask those questions, that question. We have a note which I will mark as a court trial exhibit. What's the next court trial exhibit? 71. Has anybody taken 71? No? All right. So we'll mark it as court trial exhibit 71. This is from juror number 640, and it reads as follows. For most days off, for most, days off may be good, but for me, I don't get paid for those days, nor am I able to go into work for the off days because it wouldn't work for the employer. So some are workable, but not too many. Thank you. And that must be referring to the fact that we're likely to take a few days off next week, but there's not a whole lot we can do about it. So what I propose is perhaps just addressing it with all the jurors and just simply saying the delays are not just because we want to take some time off. We can't avoid it, and we have to be off on those 3 days, but we're hoping to do some work when they're not here. Some work that we have to do anyway. Is that okay with the people?
Yes, Your Honor.
All right, is that okay with the defense?
Yes, Judge, I'd make that request specifically, and I think it's a good idea to point out that we have work to do. You may even say we have jury instructions to work on or something like that so that they know we're not just hanging around.
Okay, I will do that. Thank you. All right. Is there anything else we need to talk about at this time on behalf of the prosecution, Mr. Brockler?
No, Your Honor. Thank you.
Is there anything else on behalf of the defense, Mr. King?
No, Your Honor, not now.
Okay. Is there, are the people anticipating the Hotmail emails being introduced or attempted to be introduced during the afternoon session?
Judge, it's through Special Agent Phelps, who's here every day, so it doesn't have to necessarily be today.
Okay. All right. Thank you. Okay. The court will be in recess. Thank you.